So, Dr. Mandy, some women actively seek out a diagnosis. Other women, for whatever reason, would shun having a label. Have you encountered this in your lab?
Yeah, definitely. I mean, the other way I've seen this as well is the difference between how children and adults can respond to a diagnosis as well. So, for example, we did a study with kids who'd been diagnosed in our clinic, and the findings were quite disappointing and caused us to change our practice quite radically, in that a lot of them, A, they didn't want to be taken to the clinic in the first place, their parents made them go, B, all they wanted to be was normal, which is what most adolescents want, and they felt they were being told that they were abnormal and there was something wrong with them, and C, generally they, as a result, they just disengaged from the diagnosis and didn't know anything about it because they just didn't want to go near it. Whereas I've had quite a different experience working clinically with adults, where normally they come because they're seeking it, they feel they have an issue in their life that this could help with, and you would have more to say on this than me probably, but I think a lot of them, they no longer feel as blamed for things that have gone wrong before. It's almost like, it wasn't me messing stuff up or me doing things wrong. It was autism. That's how it explains some of these difficulties I've had before. So I've known quite a few people who felt quite liberated by the diagnosis. And
they're validated.
Validated, okay, yeah.
But there is a grieving process, I find.
Right.
There's also some self-blaming.
About what?
Just mistakes you've made in the past that you can't fix now.
Yeah.
Relationships that are gone, jobs that are gone.
And were you thinking, I wish I'd
known sooner.
Yeah, okay.
And there's sometimes the blame on practitioners because they didn't see the signals and refer you earlier. But, there's a trite saying, you can be bitter or you can be better. And I guess some of us have decided that if we work towards the betterment of the situation for other women, that maybe they'll get diagnosed sooner than we did.
Yes. Yeah.
So that's what really we're about with Spectrum Women.
Yeah.
And nobody should have to suffer through that and maybe go through sexual abuse or homelessness or joblessness or alienation, being alone. I mean, you can be alone by choice, but being lonely is not a way to be. And just finding our tribe, it's been really a revelation to most of us that there are other women out there, and we only met online, most of us.
Yeah, but totally. That's another thing I've come across in our work, is this notion of online communities really giving people a sense of identity and a place in which they don't have to mask and camouflage, where they can feel they can be more themselves and more kind of comfortable and authentic.
And the early pioneers like Jim Sinclair, Donna Williams, they really had to physically meet at some point, but the internet gave them the avenue to reach out and make those initial contacts and then start running retreats and conventions. And just showing up at all these conventions that are very much on the medical, clinical model and saying, we don't just want to be on a panel, we want to actually have topics that are for adults, or maybe a luncheon, or an extra day tacked on so we can meet and get to know each other, because divide and conquer, I mean, that's been the situation for decades, and I think the last 10, 15 years has been a radical reframing of the discussion that you mentioned, having a true dialogue rather than we think we know best for what autistic adults need.
I think there is another element to this, which is certainly in the UK, I don't know what it's like in Canada, we do have some diagnostic services now for adults. There was an act of Parliament that said that had to happen, so councils have gradually set up autism diagnostic services. They've got long waiting lists, but they do exist. And the trouble is that once people then get diagnosed, there's almost nothing for them.
Support.
And so if you think a lot of the people who are getting diagnosed have really quite severe anxiety difficulties and depression, and often need treatments that might take account of their autism. It doesn't need to be a totally different treatment, but it probably, those services just aren't there at the moment. So there's a bit of them where you kind of give someone a diagnosis, and then it's kind of like, oh, well, check out this website, and off you go, good luck.
Here's a list of
that
books.
Needs to change. Yeah, exactly.
Which you may already have read in my case.
Yeah. So there's we've talked about the kind of cultural and identity impacts of a diagnosis. But diagnosis should also have an impact just in terms of helping people select treatments, which they then receive. And I'm pretty sceptical that that's happening much in England anyway. I don't know about Canada.
Not much here. I mean, we're just trying to get the youngsters into a system diagnosed. So, I mean, you feel like, oh, why are we complaining? At least we survived. But, what kind of quality of life is there? And, as we're getting older and deciding what our life outcomes will be, what kind of legacy we leave behind, that's also painful to contemplate. And I think women are starting to speak up and say, I don't want to settle for this, I want a better outcome.
But also it sounds like your legacy will hopefully be avoiding other people having to wait until they're 48 or whatever it was to get diagnosed.
Oh, true. Thanks very much for speaking with us.
Sure, pleasure.